Tell me when. Okay, this is exciting for me. First of all, I want to do a couple of things. Introduce my team. I am Dr. Nadir Ali, a cardiologist in the southeast part of Houston, which is near NASA. And we have a very busy practice. And we've been talking about nutrition and health for at least 5 years. Most of this Facebook event and our growth on the internet and social media would not have been possible if we didn't have the team that we have. And a principal component of that team is Melissa, who is sitting behind the camera and recording and organizing this. We have a nurse practitioner, several other medical assistants, and a nurse practitioner at the hospital. So if you have watched any of our YouTube videos, you would see that we are very passionate about what we do, and we find a purpose in life with regards to improving the health of our patients through nutritional advice and lifestyle changes. So having introduced my team, I want to say that it's an absolute honor to be a part of Adapt a Life event from several standpoints. Number one is that Dr. Eric Westman is an icon in this field. And the reason I say that, and I don't give praise unnecessarily, but Dr. Eric Westman deserves everything, because back in the old days when nobody knew anything about this field, he spent time with Dr. Robert Atkins in his office in New York, and has been practicing low-carb diets for improving the health of his patients for many, many more years than anybody who is currently active in this area. So an important aspect of this is for people to understand that the depth of experience that he brings far exceeds that of any practitioner at this time who is giving advice, nutritional advice in this field. So one would have to say that it's an absolute honor to be on the same stage with him. I also watched Cynthia Miller's, I have not met her, I'm looking forward to meet her. And I watched her Facebook Live last week, and she is an absolutely delightful lady who is full of important insights as to how people can institute a low-carb program, understand human biology, understand human digestion, metabolism, so that they can improve their health, reduce obesity, reduce diabetes, reduce chronic illnesses. So I am not able to see the questions that people are asking, but if there is an important question, Melissa is going to reframe and redirect it towards me. So I look forward to the event next, I guess on May 19th, which is a couple of Saturdays from now. And it's going to be at the George Bush area, the George Bush Intercontinental Airport area. And it's at the Doubletree Hotel at about 8:30. And what I'm going to be really focusing on in my segment is to try to explain the conventional wisdom that mainstream medicine gives people, that one of the biggest risks of getting heart disease as well as diabetes is to eat a diet that is high in saturated fat. So the conventional wisdom thinks that diabetes is a strong risk factor for heart disease, and so heart disease is because people eat saturated fat that increases cholesterol levels, and that leads to heart disease. So this kind of information has been propagated by mainstream medicine for the last 50 plus years, and it has increased the obesity epidemic. Obesity has gone up from 10% to 33%, And the combination of obesity and overweight individuals in the United States is a staggering 68%. And we are all suffering from the consequences of either being insulin resistant or being diabetic or hypertensive or having heart disease. There is an increased risk of cancer, and there is an increased risk of dementia and strokes from this. So for us to understand how to improve all of this, a group of people, and I would say right now it's probably about 1% of the population, is very passionate about informing the rest of the world, the rest of the people in the US, as to how misleading our nutritional advice is, and how saturated fat and cholesterol is compatible with not only normal life, but with a potential for optimal health. Many physicians do not recognize and do not ask a simple question about cholesterol. And the question is that why does our body make cholesterol? And how does it transport cholesterol in the bloodstream? Because an important aspect is to recognize that cholesterol is a waxy, fatty substance, and our blood is like water. It is water-based. So if you take a beaker of water and put oil into it, the oil and water don't mix. So the body, in order to carry cholesterol and fat in the bloodstream, because it needs fat for energy of the cells that the body is made up of. So in other words, muscle cells use fat energy so that they would be able to function. And similarly, our brain can use fat energy, and almost every cell in our body, with the exception of the red blood cells, can use fat energy. And in order for this fat energy to be transported, one of the main ways it transports it is in the form of triglycerides. Our body needs cholesterol also, and cholesterol is needed by every single cell in the body. The cholesterol is needed to make vitamin D in the skin from exposure to sunlight. The cholesterol is needed by our adrenal glands to make important steroid hormones. The cholesterol is needed by the ovaries and testes to form sex hormones, because the backbone of the sex hormone is a cholesterol molecule. Our muscles need cholesterol in order to be able to burn energy, because the CoQ10, which is a product that the machinery of the muscle uses, is a cholesterol byproduct. So it's important for us to recognize that the body needs to transport cholesterol and triglycerides in the bloodstream. And the way it does that is by packaging them into these boats. And these boats are called lipoproteins. So in other words, in order to carry them in the bloodstream, it forms these lipoproteins which have a protein cover, and they have a phospholipid kind of an outer layer which makes it dissolve in the bloodstream. And the core of the lipoprotein is cholesterol and triglycerides. So that is the first major function of the body, is to make these lipoproteins so that it can distribute energy to the other cells of the body. So this is a very simple and very important function of lipoproteins, but if you were to ask about 100 cardiologists as to what is the primary function of the LDL, which is considered to be the bad cholesterol, and I hate calling something bad because it gives it wrong connotations. Why would the body make something that is bad or inherently bad? There are functions of LDL cholesterol. So getting back to my premise, if you were to ask 100 cardiologists, why does the body make LDL cholesterol? They will not be able to tell you. And they would not even be able to tell you the primary function of LDL cholesterol, which is to distribute energy to the other cells of the body. But that's not the only function it does. It carries fat-soluble vitamins. It carries antioxidants so that it can fight injury to other cells. The LDL is an important molecule to neutralize bacteria and viruses, so it's an important defense mechanism of the body. The LDL is also important for repairing cells, because when there is cell injury, the cells need cholesterol, and the LDL supplies cholesterol to it. The LDL carries CoQ10, and CoQ10 is an important aspect of muscle function, as I have already described. So there are studies that are done by great people in this field. One of them is Dr. Malcolm Kendrick, and he's analyzed about 70,000 patients and has come up with information that after age 50, people with high levels of LDL cholesterol have better cognitive function, better memory, lower risks of infection, lower cancer risks, and longer lifespan. So a higher LDL level, something that is to be celebrated, is actually a significant cause of concern to the majority of people, because they are unaware of certain important information about the lipoprotein in terms of what it does, why the body makes it. Is there any alternative data with regards to the functions of the LDL? So I must tell you that when we look at cholesterol in our office, we always are concerned about cholesterol quality. And when you come to the Adapt a Life function, I would be talking about how you can properly evaluate cholesterol quality rather than focusing just on the LDL molecule. I'll leave you with a couple of important information with regards to cholesterol and population studies. So let's take World War II Japan, for instance. World War II Japan had roughly 35% lower cholesterol compared to the westernized populations. At that time, the incidence of stroke and heart disease in Japan was much greater. Of course, the Japanese population smokes a lot. Now, there was a concerted effort to increase the amount of saturated fat in the Japanese diet, because they recognized that they had a much higher risk of stroke, especially bleeding strokes, and their diet was predominantly carbohydrate based. So over the last 50 years, the amount of saturated fat in Japan has gone up several fold. Cholesterol levels have approached those of the Western population. So one would expect that cholesterol levels went up, and so heart disease should go up. But the heart disease came down by 400%. So when I say 400%, that is fourfold. One would also think that conventional wisdom tells us that higher the cholesterol, higher the risk of stroke. So as the Japanese people's cholesterol went up, the incidence of stroke didn't drop by a small percentage. It dropped by 700% or sevenfold. So that's one information. I'm going to be talking about the Monica project, which is European information about the levels of cholesterol in European countries, about the fat intake in different countries, and whether there is any correlation with higher cholesterol and mortality, higher cholesterol and heart disease, higher cholesterol and strokes. I will also be touching upon some of the new studies that have come out with regards to reducing cholesterol with the newer agents. I'm not sure if you have heard about them, but there are these molecules that are called Pcsk9 inhibitors. So it's a little mouthful, Pcsk9, K as in K and 9 as the number 9. And these are injections that you take in your thigh about once every 2 weeks. and they drop your LDL cholesterol to below 50 milligrams per deciliter. So if you know about cholesterol or LDL cholesterol a little bit, the guidelines are that if you are over 100 and you have risk factors, one should strongly consider putting you on a cholesterol lowering drug. And coming between 50 or 30 and 50 milligrams per deciliter is very low levels of LDL cholesterol. So there have been 2 studies that have come out, and the first study followed 28,000 patients for approximately about 2 years, and it had no impact on death. In fact, the number of people dying in the group that took the drug was slightly higher than the number of people who died in the group that did not take the drug. Now, the second study that was just presented at the American College of Cardiology in March, which is called the Odyssey Trial, had about 19,000 patients, and they followed them for roughly about 3 years. And at the end of 3 years, the difference in death rate was 0.5%. And that's a minuscule amount. So in other words, if a person took this drug for 1 year, the chances of him avoiding death compared to somebody who didn't take that drug would be about 0.2%. So as minuscule as that. And the magnitude of effect of pharmaceutical agents in improving the health of individuals is quite small. Finally, we will be talking about insulin resistance and what it means, and the paradox of trying to reduce insulin resistance. So in order to reduce insulin resistance, one has to consider reducing refined carbs and refined food. And when you do that, you have to replace calories with fat, and we recommend that you replace calories with saturated fat. So as you replace calories with saturated fat, your cholesterol inevitably over a period of time will go up, while your insulin resistance and all markers of diabetes is improving. So if you go by conventional advice of mainstream medicine, and I was a part of that for over 25 years, and I'm still a part of it, but I feel that I need to break from the tradition and get to the public certain very important information, not only about LDL cholesterol, but also about insulin resistance, because the fundamental treatment for diabetes in this country is to encourage people to eat carbohydrates and take insulin to control their blood sugar, or to give you medicines that increase the body's production of insulin. So the best way I explain this is the following. Like, let's say a person's fasting blood sugar in the morning is normal at about 90 milligrams per deciliter. And if that person has an insulin of about 5 micro units per ml, that person is insulin sensitive, and it's requiring a decent amount or a low amount of insulin to keep the blood sugar in that range. On the other hand, to keep the blood sugar at 90, if that person is requiring 10 to 20 international units of insulin, that means that that person is requiring a much higher level of insulin to keep blood sugars in check, and that would be considered insulin resistance. And high levels of insulin are not good for us because, number one, they create cravings. Number two is that insulin prevents the brain from seeing satiety signals, especially at high levels. Number three is that it increases appetite. Number four is that insulin creates some biochemical changes in our body that increases the risks of blood pressure. Number five, it increases the risks of obesity because we start packing in fat into the fat cells. And number four, insulin gets co-secreted by the signals that we are talking about with insulin-like growth factor, and elevated levels of insulin-like growth factors on a chronic basis can be associated with cancers. So insulin resistance is not only associated with high blood pressure, heart disease, obesity, but it's also associated with cancers. So this is an exciting session for us, and there are many more aspects of nutrition and health that we would like to cover. And what I'm going to tell you is that, like Socrates and Aristotle said, the unexamined life is not worth living. And so I would like to say that an unexamined nutritional strategy is not worth eating, because it's going to lead to ill health. And I encourage all of you to take charge of your lifestyle through nutrition, through exercise, through sunlight, through sleep. And these are different aspects that are going to come up. Lastly, I also want to add that on October 25th to 27th in Houston, we are going to be running a big nutritional seminar. It's a 2.5-day event. It's in collaboration with University of Houston Clear Lake, and October 25th to 27th, it's at the Bio Theater, which is a beautiful theater on the campus of University of Houston at Clear Lake. So I look forward to seeing you at the Adapt a Life function at the DoubleTree Hotel near the George Bush Intercontinental Airport on May the 19th. And I think that the tickets are available on Eventbrite, and the link is posted on Adapt a Life. So I'm just turning towards Melissa to see if there are any important questions that we need to answer. And if there are not any, then what I'm going to do is go through the questions in an offline format and respond to them through Melissa on Facebook. Thank you.